Joining me now is the co-founder, head public sector growth, Helium Health, Titi Ovia. Titi, it's good to have you join me right now. Now, break it down for us. When it comes to the issue of telemedicine, the word telemedicine makes it look like it's heavy technology or something very advanced. Break it down for us. What really constitutes telemedicine?
Hi, good morning. So telemedicine is, like you just rightly said, it makes it seem like a very big technology, scary word. But telemedicine is just the ability to be able to provide care virtually. That's literally what it means. So whether it's, through a phone, FaceTime, or WhatsApp, or through a specialized technology, that is basically what the concept of telemedicine is, basically virtual consultations between healthcare professionals and patients.
Now, how would you assess the effectiveness of observation when the medical personnel is supposed to observe closely the patient, apart from beyond the issue of describing how you feel? How effective would that be?
So a lot of the times when doctors actually want to treat patients, a lot of what goes into that is their history. So before you actually or begin to actually start examining a patient, you actually have to collect their history and actually know about them. Of course, a lot of times as well, what telemedicine is doing now is that it's actually reducing the burden on the hospital workforce. So I heard you talking about the lockdown, right? Yes, we do know that in certain situations, you do have to actually, test the patient and actually possibly listen to their heart with a stethoscope. However, though, to be able to reduce the burden on the workforce, telemedicine is important so that you can, first of all, triage the patient first. At the end of the day, you don't want patients unnecessarily coming into hospitals and coming into across or them being possibly COVID positive and then infecting other people. So telemedicine actually affirms that the first points of call and the first triaging point, when seeing a patient, especially in a situation like this, in a pandemic that we're facing, before you then go further to examine the patient if necessary.
All right, when it comes to access to internet, access to gadgets, computers, or smartphones, how ready do you think Nigeria is for telemedicine?
So I can actually say that from data that we've gathered, majority of healthcare practitioners and even the patients that actually go to these hospitals actually have some sort of smartphone. So a lot of people, believe that, you must have, a fancy laptop or tablet or, the latest iPhone to be able to have televisits. But literally, it can go from even the low end of the scale of the spectrum for you to be able to do this. When it comes to data, we've seen, especially during this time as well, that certain telecoms companies have been doing data packages as well to be able to cheapen the cost because they do know that everybody is at home. But the point of it is that doctors must continue to see patients. There are patients that do have chronic diseases such as diabetes, such as high blood pressure, that must consult their doctors regularly to be able to keep up their condition. So regardless, telemedicine is something that needs to happen during a point in time like this.
So how impactful at this critical time where everyone is talking about COVID-19, how pivotal will be telemedicine at this time?
So with COVID-19, we've seen with other countries that, have faced this critically, like the US and like the UK, human capital is actually the biggest problem that people have. And especially in a country like Nigeria, we actually don't have enough healthcare practitioners and doctors to be able to deal with this. And that's something that's very concerning. So what telemedicine does is that it stops people from going to the hospital unnecessarily and actually sort of burdening further the workforce. It stops patients that, for example, might even be COVID positive to even be triaged, first of all, by healthcare practitioners. So they can then, of course, send them and refer them to NCDC or even to their different states' COVID-19 task force. So what telemedicine does is that it actually helps to be able to identify positive COVID-19 patients, positive patients, first of all. And most importantly, those that actually need care, those that don't even need urgent care, would actually just not be able to burden the workforce that we already have. So it actually makes sure that we're able to extend our human capital that we need for COVID-19.
So from your perspective, what are the greatest challenges telemedicine will encounter in our society like Nigeria? Because beyond Abuja and Lagos, maybe Port Harcourt and a few other cities, there are other places where it is more of a rural area.
So definitely telemedicine is something that, like you rightly said, it's not new, but of course in our part of the world, it is brand new, right? And it's just about being able to adjust the model. So like I said earlier, telemedicine is the ability to be able to have virtual visits. So that visit can definitely be a video call like we're having now, or it can even be a phone call. Again, it's being able to adapt it for those different areas, but it's something that, of course, people thought, about 10 years ago, right? That the idea of being able to go to the market and, make a transfer to the vendors there would be impossible. Who would accept it, right? But it's something that people do now regular. It's part of our everyday lives, instantaneous transfers. So telemedicine is something that I feel like this pandemic will force, whether it's the rural communities, urban communities, and force them into doing, because it is most definitely a necessity, because people will need to have care.
All right, Titi Ovia, thank you so much for talking to us on TVC Breakfast. Joining me now is the co-founder, head public sector growth, Helium Health, Tito Ovia. Tito, it's good to have you join me right now. Now, tell us about Helium Health and the new solution designed for healthcare facilities and professionals.
Hi, thank you so much for having me. So, Helium Health is a healthcare technology company that started in 2016, and our mission is to basically drive Africa's healthcare sector with data and technology, because we've seen that that has really prevented the growth of healthcare in our region. Our primary, resource as a company, primary product is actually our electronic medical records platform. However, given the pandemic, we actually came together as a company and looked internally and said, what can we do to be able to provide more value to our hospitals that we have? So we actually decided to be able to give free telemedicine throughout the month of April to across all hospitals, Nigeria, Ghana, and Liberia, where our facilities are, just to be able to ease that burden, because we do know that they need to somehow continue seeing their patients and continue care.
All right. Now, do you think that telemedicine can improve patient-centered experiences and ease the healthcare burden of COVID-19?
So I really believe that telemedicine can actually improve, the healthcare burden, because not so many people are now going to the hospital. So, for example, typically maybe your child coughs once and you rush them straight to the hospital. Parents are now sort of having to think more. Maybe they'll now call the doctor instead and have a video call. So again, there are more doctors to actually treat COVID-19 patients and actually triage possible positive patients first. But also as well, doctors are having to actually take time and actually sort of listen to the patients, because there's not sort of a wait list of patients outside banging at their door and without that rush. I think it's also a benefit as well for providers of healthcare, as they're able to reach a wide reach of patients. So it doesn't matter whether a patient is in another state or, in a different time zone, they're able to attend to them and give them care no matter what.
All
So
right.
it's a win-win for patients and providers.
Now, one of the downsides to telemedicine is that it can be expensive to set up and maintain. How does the organization intend to bridge this gap?
So I think it's a large misconception that, telemedicine is, it's very expensive. And I think it has to do with the name, like we discussed earlier, telemedicine. It gives the assumption that, you require, all sets of devices and you need to be so tech savvy. However, though, if you just have a smartphone, you're able to access this service. But then again, most importantly, people actually forget, and I mentioned this earlier, that doctors are able to reach now more patients at the same time. Patients so reduce even the cost that it would take them, driving to the facility in the first place. And even for hospitals as well, they even reduce the cost that they would even spend at the hospital. So, if I was a private doctor, I could literally just set up my own practice and my own telemedicine service and start seeing my own patients straight from the comfort of my own home. So a lot of administrative costs are removed.
All right. Now, can you run us through a quick process of how this works from adoption up to when it is being used?
So for Helium Health, all you would do is just send us an email at team@heliumhealth.com. straight away within the next couple of hours, one of our customer service reps will actually get in contact with you. They would collect a couple of details from you, and within the next hour or so that same day, your virtual clinic can actually be set up. And as soon as you're set up, all you need to do is actually just book appointments with your patients. Those patients will then receive an SMS immediately reminding them of their appointment booking, as you would do for any service, and with a link as well for them to be able to join when it is then time for their virtual visit with you. So it's very easy, very quick. There is not so much hassle. Again, all you needed to do is we have internet and a smart device.
All right. Can telemedicine be adopted for all kinds or all sorts of or all illnesses, or there are some that the doctor still certainly needs to do a physical observation?
So what telemedicine does is that it actually provides the first point of care for patients. It provides the first sort of triaging points, I would like to call it. So that means that, when doctors are now able to speak to the patient, they then decipher, okay, what is then next? Do I physically get to see you? Do I have to see you? Do I need to send you to a lab to do tests? So telemedicine allows doctors to first of all decide, okay, who is in urgent need of care and depending on what disease they might have. So for example, a patient that is asthmatic might find that during this period, their inhaler has sort of reduced effectiveness. That the doctor might need to prescribe another inhaler, might need to listen to their chest and so on and so forth. Again, it all depends and you have to take it on a case by case basis.
All right. Now, telemedicine, a lot of people would say will run better in urban areas. How about rural areas? What options are open or left to them?
So I believe that, telemedicine, with the name, everybody assumes that it must always be a video call. Telemedicine is just the idea of being able to actually connect with your doctor. So if you're actually able to have a phone call with a medical practitioner, that is actually a form of telemedicine. So in rural areas, as we know, people already are able to use their phone and make phone calls. That can now be the form of telemedicine that is then adopted in those areas if internet and if video calls are not feasible. But I believe that it's definitely something that is scalable no matter where you are in the world and no matter what part or what demographic you are.
All right, Tito Ovia, thank you so much for talking to us on TVC Breakfast, and we thank you for what you do. Right, let's tell you that the views and reaction of our resource persons on the topics discussed today are their views and have no connection with TVC News. We thank you for watching. You can keep up with us on social media using the hashtag TVC Breakfast.